Greetings. Mushtaq Memon, Professor Emeritus from Washington State University. I welcome you to my YouTube channel. So we are going to continue talking about integrative veterinary medicine after the basic introduction on traditional Chinese veterinary medicine. I'm going to just dive in another modality of IVM or part of TCVM is acupuncture. Veterinary acupuncture is an excellent modality, which I have used for many, many years in so many different conditions in animals. It does very well in terms of complementing with our Western therapies. And again, it goes back with Chinese medicine, which was evolved more than 2,000 years ago. And it was originated in China, even though many other countries claim that maybe different version of that has been practiced in some other parts of the world. But for our purpose here, we will just focus on this one thing. So that original concept of acupuncture, or TCVM, has been practiced also, or is still being practiced in many countries, at least in Asia, to name Taiwan, Korea, Japan, and some parts of also Europe. And there may be a little bit difference from the original concepts, but all really has the same goal to try to make our patient feel better or recover from the problem an animal has. And it is now well accepted in Western countries, and it is, a lot of information is published, in fact, on some of the conditions like I mentioned here, pain, acute as well as chronic pain. I think acupuncture does very well. To decrease inflammation, acupuncture is helpful. Nausea, vomiting, brain and cord injuries. So you could see some of these conditions also we see in Western medicine, and they complement each other very well. And depending upon how far back you want to go, there are some publications or books published in Chinese. Now, why in Chinese? Why not other languages? Well, Chinese had the benefit of inventing paper. So when they invented paper, they started writing things. So there are texts available in Chinese, which may be more than 500 years ago. So I think that has been the advantage of Chinese medicine, that it has been well kept, if you will, for us to learn more from. So the first information which we have available is that acupuncture in animals was practiced in horses. So we have a complete description of different acupoints and where the location is, and then what kind of condition that could be treated with. So going further down, so the basic concept which I touched upon in my first video on TCVM is the Qi, which is a force of life, and which has a concept of balance. Balance is a root of Chinese medicine, which like to see the body is in balance. And then the Qi concept, Qi flows through meridians or branches or channels in the body. So each meridian then have certain places identified as acupoints. So we try to stimulate those acupoints to balance the body, and then go along with the concepts of yin and yang. So if you really stop and think, TCVM really helps to strengthen the body, so that give capability to body to heal itself. Now, Personally, I think the TCVM is excellent concept, also prevent problems. And in my own life, I practice that concept. I try to be careful what I eat, and then how I keep myself physically and mentally active by doing some kind of exercises. So I think these are the concepts that which could help us all in our own lives, as well as, for our patients, our animals. Now, how does this acupuncture work? Well, there's a lot of information available, but just to give you some concepts here, that the problems when disease is there, as I mentioned earlier, when you have a disruption or blockage of that energy flow or chi flow, then we have a disease. So how to balance that back so that animal can heal itself with the balancing of chi, yin and yang. And then, so what really acupuncture does is just, it restores the normal body homeostasis. And then it creates that healing. There's quite a bit of work now being done on regeneration of cells and using acupuncture for that. But without going into too many details, I would like to just go on and tell you some of the other concepts. So this picture shows here the meridians, channels, how they run it. So there are a total of 14 channels that we use. And out of 14, 12 channels are located on both sides of the animal. And the 2 channels are running, one from the dorsal aspect and one from the ventral aspect of the animal. So total makes it 14 channels. And then we employ acupuncture in different ways, but the 3 most common ways are that we try to use dry needle acupuncture. So these are one-time use sterilized small needles that we use in animals, depending on the size and the species of the animals. Obviously, for dog and cat will be small size than the horses. But so we use those needles to stimulate acupoints. So that we call dry needle acupuncture. So if we need to stimulate more, especially in older animals in chronic condition, we can hook up those needles with extra stimulation with electro acupuncture. So we have machines, as you can see on this picture at the bottom, is the electro unit, which is hooked with the needles to give extra stimulation. And there are certain animals which do not like needles. So rather than leaving needles in at the acupoints for 15 or 20 minutes, we just go ahead and try to take some fluid. And the most commonly used fluid which we use is the vitamin B12. And in many animals, I even dilute that vitamin B12 and then inject at the acupoints so that we don't need to leave the dry needles in. And the fluid stays there and stimulate those acupoints. Now, those 14 acupoint meridians or channels which I mentioned are listed here. And as you can see, most of them are specified with the organs. So many times organ doesn't mean that it's focused only, let us say, on lung. So the number you see next to lung is the number of acupoints on that channel or meridian. So lung channel or lung meridian has 9 points. But when I think carefully, it's really the concept, and it is the system, not necessarily the organ, but they're identified with organ. For instance, the spleen, as you can see here, mentioned 21 points. So spleen doesn't mean that the focus on the spleen, it almost focuses on digestive system. So it comes together fairly well once you start learning more about it and practicing these concepts. So the clinical applications are in so many conditions, as you can see on the top is pain management. And the pain could be in any animal at any stage, But in our, older animals or animals which are like horses, used for different work and racing and things like that, get quite a few conditions where require, remedies to relieve the pain. So acupuncture is very helpful. Immune regulation. We are learning more and more how it can help to regulate immune deficiencies and immune problems. I have personally used acupuncture along with the Western therapies in some cases, and it does work. And again, it's not cure at all. It does help in when you try to use it properly diagnosed condition. Neurological conditions, very well researched, very well practiced. You may look into these conditions and you see how excellent this therapy is. Behavior problems, aggression, anxiety, animals I have seen can calm down very well. I have also used this acupuncture in animals which are being transported. They calm them down for a journey, a transport in cars and things like that. Dermatological problems, more and more we are learning about it. And then the quality of life. Now, what does it mean? That means number one is the prevention of problem, which I mentioned earlier, which I believe very strongly, but also the animals when they are getting older or getting close to the end of their life, to keep them comfortable. I have used the acupuncture in some oncological or cancer patients. And the client knows, the owner knows that this animal is not going to live very long, but try to improve the quality of life. Acupuncture works very well. Now, as I have been mentioning, when to use acupuncture, I think my, soapbox is that you have to think about how we can complement acupuncture with our Western therapies, because Western therapies do a wonderful job. These are the Western therapies which have done so much research, and all the equipment and all the diagnostic stuff, radiographs, MRI, CT scans are readily available. And then it becomes much easier for us as a practitioner to find out what exactly the problem is, where the problem is, and then how to treat it. So those are the places I would say that you ought to think about it. And also the rehabilitation part of it. Post-surgical cases where they're trying to recover. I think acupuncture does a very good job to contribute towards that pain management and recovery of that post-surgical animals. And then I will discuss a little more about later on in our video series here about rehabilitation and things like that. So really the take-home message would be that acupuncture is safe. It does not have any bad effect. We have to be careful in certain conditions that acupuncture should not be used. For example, I specialize in reproduction of animals. So if you have a pregnant animal, we try to be careful when we choose acupoints to try to, not to use in the back of the abdomen or back of the body, in fact, to not to cause any problem with the pregnancy. And then when you are using with conventional therapies, we have to make sure that they complement very well. There are certain conditions like some of my friends, oncologists, use certain chemotherapies and radiation therapies in animals. So some of the herbal therapies may be carefully chosen so they are not contradicting with the whatever is being already done with, different conditions. So I'm just so pleased and thrilled really to see our board certified oncologists, immunologists, cardiologists are getting more and more interested to finding out the benefits of acupuncture and TCVM and how they can implement in their therapies. So I have mentioned again references here that you would be probably benefited by reading them. And if you want to dig deeper, these references are very, very helpful. So the next video I'm going to discuss with you will be the diagnosis, how we do diagnosis with traditional Chinese veterinary medicine. It is not standalone, but it has got few very unique things that you would probably enjoy knowing and listening about them. So until then, I would let you, take your own decisions, what you like to do. And I will see you soon again on follow-up video on TCVN diagnosis. Thank you.